We'd like to recognize and say good morning and welcome to Dr. Josiah Blessing, nursing tutor at Turks and Caicos Islands Community College. Pleasure to have you. We now begin our remarks. Good health care depends on teamwork, and today's conference is a reflection of that spirit of collaboration, starting with Ms. Mickett Bean, Chief of Clinical Services and Acting CEO, TCI Hospitals InterHealth Canada Limited. Put our hands together for Ms. Bean.
Allow me to adopt the protocol that is already established. And apologies for our CEO, Dr. Denise Braithwaite, who's not here today due to other commitments. Good morning, distinguished guests, colleagues, partners in healthcare, and most importantly, our nurses. Today, we gather to celebrate International Nurses Day, observed on the birth anniversary of Florence Nightingale, the pioneer of modern nursing. This day is more than a celebration. It is a moment of reflection, recognition, and recommitment to the profession that stands at the very heart of healthcare. This year's theme, Our Nurses, Our Future, Empowered Nurses Saves Lives, could not be more timely or more relevant. Across the world, nurses are working in increasingly complex environments, facing workforce shortages, rising healthcare demands, climate-related health emergencies, public health crises, and lasting effect of conflict and inequality. Yet, even in the midst of these challenges, nurses continue to show up with courage, compassion, skill, and unwavering dedication. Today, I want to begin by saying thank you. Thank you to the nurses who work long shifts and still show kindness at the bedside. Thank you to those who advocate for the patients when no one else will. Thank you to the nurses who lead, teach, innovate, and mentor, often without recognition. Thank you to those who remain resilient in environments that demand so much and give so little in return. Your work saves lives every single day. However, this theme also challenges us to go beyond appreciation. It calls us to action. It reminds us that nurses cannot save lives if they themselves are not supported, they are undervalued, or they are unheard. Empowerment is not a slogan. It is a responsibility. Empowered nurses are those who work in safe environment where their physical, psychological, and professional well-being is protected. Empowered nurses are those who receive fair and equitable compensation that reflects the value and complexity of their work. Empowered nurses are given access to education, scholarships, and specialization opportunities, allowing them to grow, advance, and lead within their chosen fields. Empowered nurses have professional autonomy, a seat of decision-making, and a meaningful involvement in policy development that shapes healthcare systems. When nurses are empowered, they are more effective. They are more engaged, they are more innovative, and more fulfilled. Empowerment fuels both intrinsic motivation, and that is the passion and purpose that drew many of us into the profession, And extrinsic motivation, that is the recognition and the support that sustains us. This is especially important as nurses take on an expanded role in primary health care, community health, prevention, and population health. And these areas are critical to the future sustainability of healthcare system worldwide. On this International Nurses Day, as we honor Florence Nightingale's legacy, I invite each of us to reflect on one important question. What is our true calling as nurses? Is it simply to complete tasks, or is it to lead change? Is it to follow systems or to help design them? Is it to survive the profession, or is it to shape its future? Our nurses are not just the backbone of healthcare, they are the future. And our future depends on how boldly we choose to invest in, trust, and empower nurses today. So let us commit collectively to creating environments where nurses are heard, they are valued, developed, and supported. Let us ensure that empowerment is not an exception, but it is the standard. Because when nurses are empowered, patients receive safer care. Communities become healthier. Health systems become stronger. And lives, countless lives, are saved. Happy International Nurses Day. Thank you for your service, your sacrifice, and your unwavering commitment to care. Our nurses, our future, empowered nurses saves lives. Thank you.
Thank you very much, Madam Acting CEO. You know, when I look at this room, I feel so good that all of you chose nursing, because I couldn't. So I'm grateful that all of you indeed chose nursing. I'd like to acknowledge she's online, and so out of my line of sight, and I omitted her earlier, but our Deputy Permanent Secretary in the Ministry of Health and Human Services is also joining us online, and we'd like to say good morning to Miss Renessa Williams. So good morning, Deputy Permanent Secretary. Healthcare systems may be built with infrastructure and technology, but it is nurses who bring healing to life every single day. Please join me in welcoming Chief Nursing Officer, Mrs. Jacqueline Sutton.
Thank you, Mrs. Foreman. Come on, put your hands together for our moderator, Mrs. Foreman. And she has never let me down. I'm not going to add yet. Just going to say she's never let me down. All right. I acknowledge the established protocol and extend heartfelt greetings to the Honorable Kyle Knowles, Minister of Health and Human Services, for taking time out of your busy schedule to be here with us today. I know you're a very busy Minister of Health. Thank you for what you're doing for nurses. I also wish to acknowledge Mrs. Desiree Lewis, our Permanent Secretary in her absence, and also Ms. Renessa Williams, our Deputy Permanent Secretary, Dr. Nadia Astrid, our Chief Medical Officer, who is online, my colleague, Mrs. Anastasia Jordan, the Chief Nursing Officer for Barbados and Chair of the Regional Nursing Body, and our keynote speaker for today, members of the executive leadership, stakeholders and partners, and you, my fellow healthcare professionals, especially you, the dedicated nurses and nurse aides, who are the backbone of our healthcare system. Good morning and happy International Nurses Day. It is a privilege and a profound honor to stand before you as Chief Nursing Officer at this 5th Annual National Nurses and Nurse Aides Conference. The theme selected by the International Council of Nursing, Our Nurses, Our Future, Empowered Nurses Save Lives, is not just a slogan, as you've already heard. It reflects the lived reality of you, our professionals, and the essential role you play in safeguarding the health and dignity of our people. As nurses and nurses aid, you are the backbone of healthcare delivery, but you are also leaders in your own right. You guide patients through their most vulnerable moments, coordinate care across disciplines, and influence decisions that shape outcomes. Leadership in nursing is not defined by a position or a title. It is defined by your presence, your judgment, your critical thinking ability, and your courage to act. During every shift or workday, you demonstrate professionalism, resilience, and compassion, qualities that set the tone for safe, high-quality care. You lead through advocacy, example, and the quiet strength that sustains our healthcare system, even in the most challenging circumstances. Remembering that nursing is not only a career, but a sacred ministry, and He who has called you is faithful. I know for nurses, most of us are Christians, and most of us live out our Christian experience. So let me remind you about Isaiah 40 and 31. And he said, "But those who hope in the Lord will renew their strength." So when you are feeling weak, when you are feeling tired, weary, confused, maybe aggravated, just remember that the Lord will renew your strength. You will soar on wings like eagles. You will run and not grow weary. You will walk and not faint. So even in the days when you feel like your legs can't carry you, or your arms cannot, or your hands can't rub another back, or another shoulder, or do another bed bath, just say, "Lord, I know you are carrying me today." As you look toward the future, you must acknowledge the rapidly evolving landscape in which you practice. Digital health is transforming care delivery worldwide, and the Turks and Caicos Islands are no exception. These innovations improve coordination, reduce errors, and expand access, ensuring that no one is left behind. Yet, technology alone does not save lives. Empowered nurses do. Digital tools are only as effective as the professionals who use them, which is why confidence, competence, and adaptability is essential. And Mr. Joshua Kami, our Chief Information Security Officer from the Ministry of Innovation, Technology, and Energy, will share more on this topic and its relevance to your work later in this conference, so please do not leave. Stick around. Along with technology, education remains a critical pillar of your progress. In a world where medical knowledge expands rapidly, continuous professional development is not optional. It is a lifelong responsibility. I extend sincere appreciation to one of our partners in health, the executive leadership of the Turks and Caicos Islands Community College, and Dr. Josiah Blessing is here with us this morning. Come on, put your hands together for the Community College. Their unwavering commitment to nursing education and workforce development, the Associate's Degree in Nursing program, has strengthened our local workforce and opened doors for many Turks and Caicos Islanders and residents to pursue a career in nursing. Today, I invite you to join me as we proudly salute and celebrate those former nursing students of the TCICC who successfully completed the regional examination for nurse registration. We started out with 11. It has been a hard journey. It has been a rough road. It's one of our students who is now a nurse, proudly wearing her nurse's cap, the invisible one, will tell you. And I am going to call the name of those nurses, and many of them are not here, but I know one is here who can represent all of them. And so they have successfully completed, not the Turks and Caicos Islands Nursing and Midwifery Council exam. They have successfully completed the regional examination for nurse registration, which every nurse in this room, if you are from Jamaica, if you are from Trinidad, if you are from St. Lucia, St. Vincent and the Grenadines, you had to sit that examination. Some of you may have been in the earlier batch, like myself and Nurse Gardiner, who did the associate's degree in nursing. And we turned out okay, didn't we? Oh, yes, we did. Hey, and so I want you to salute our nurses from the Turks and Caicos Islands Community College who have been successful in their associate's degree program and also completed the regional examination for nurse registration. Nurse Alicia Da Silva. Yay! Nurse Melissa Cox. Nurse Megan Gardiner. Nurse Denise Alcius, and our most recent success stories that was released just yesterday, Nurse Katisha Kennedy and Nurse Jarrett Thompson. I would be amiss not to mention Nurse Sandra McIntosh. Nurse Sandra, just stand up for us, please. Come on, you have worked hard. Be proud of who you are. One who have worked for many years in the primary health care clinic in Kew, North Caicos. And she would say every time she saw me, Nurse Sutton, I am going to be a registered nurse. And I would respond, of course you can be a registered nurse. Go to school and get your degree. You can do this. So as of the 12th of December 2025, she holds a bachelor's degree from the University of the Bahamas and is eligible to be entered on the Register of Nurses with the Bahamas Nursing Council and the Turks and Caicos Islands Nursing and Midwifery Council. Put your hands together for Nurse McIntosh. All of these nurses I mentioned and the countless I have not mentioned were determined to achieve their career in general nursing. Often balancing work, study, and family, this attitude reflects the spirit of our profession. I congratulate them and encourage them to carry their knowledge into practice with compassion, innovation, and excellence. I encourage every nurse and nurse aide to see yourselves not only as caregivers, but as lifelong learners. Seek opportunities to enhance your skills. Pursue further education. Become specialists in your given field. Engage in research and remain curious. Whether through formal training, conferences such as this one, online learning, or mentorship, every step you take strengthens both your career and the wider health system. Don't sit down and mope about the fact that you don't have this qualification and you don't have that. The world is before you with so many opportunities. Make it happen for yourselves. An empowered nurse is knowledgeable, confident, adaptable, and prepared to lead change. The ministry remains committed to supporting your development, investing in digital competencies, and fostering environments where you can thrive. You must continue to build a culture rooted in collaboration, respect, and innovation, one where every nurse and nurse aide feels valued and empowered to contribute to decision-making at all levels. Let me also acknowledge the extraordinary resilience you have shown, particularly in difficult times, such as when we had the swine flu pandemic, the hurricanes, Ike, Irma, and Maria, who can forget them, and the COVID-19 pandemic. Your unwavering commitment, often at personal sacrifice, has not gone unnoticed. For this, I express my deepest gratitude as your Chief Nursing Officer. In closing, I challenge each of you to embrace this year's theme, not only today, but in your daily practice. In the spirit of Florence Nightingale, the mother of modern nursing, who was born on this day, 12 May 1820, continue to carry the lamp of positive change and become empowered to take ownership of your growth and development as you work together to shape the future of healthcare in this country, recognizing that empowered nurses do not just care for patients, they save lives and shape the future of healthcare itself. Thank you for your service, your dedication, and your unwavering commitment to the people of the Turks and Caicos Islands. I do not know all of your individual names. I do not know all of your specialties. But I know that I see you and I care for and respect every one of you and the distinctiveness you bring to the nursing profession. May God continue to guide, strengthen, and bless you and your families. And once again, thank you for your service.
And our thanks to you, Nurse Sutton, for your service. Nurse Sutton just mentioned that the Lord would strengthen you. And now, a distinguished healthcare professional who continues to shape national standards and national health priorities, Chief Medical Officer in the Ministry of Health and Human Services, Dr. Nadia Astwood. We ask you to turn your attention to the screens.
Adopting the protocol which has already been established. Good morning, distinguished guests, healthcare leaders, partners, members of the nursing fraternity, nurses, nurses' aides, ladies and gentlemen. Today, as we gather to observe International Nurses' Day at this annual Nurses and Nurses' Aides Conference, now proudly in its 5th year, we do so with great gratitude, pride, and a renewed sense of purpose. On behalf of the Ministry of Health and Human Services, I extend heartfelt appreciation to every nurse across the Turks and Caicos Islands for your dedication, resilience, and unwavering commitment to the people of our country. This year's theme, Our Nurses, Our Future, Empowered Nurses Save Lives, speaks directly to the heart of healthcare in small island nations like ours. Nurses are not simply a part of the healthcare system, they are the foundation of it. From our clinics and hospitals to our communities, care facilities, and homes, nurses remain on the front line of care every single day. In a small Caribbean country nation such as the TCI, healthcare is deeply personal. Our nurses care not only for patients, but for neighbors, relatives, friends, and visitors alike. They respond during hurricanes, public health emergencies. They care for the elderly, guide expectant mothers, and support families during some of life's most critical moments, and help build healthier communities through their prevention, advocacy, and more. The past several years have reminded the world that strong healthcare systems depend on strong nursing professionals. We have witnessed extraordinary courage, sacrifice, and professionalism from our nurses and nurse aides. Despite long hours, staffing challenges, and increasing demands, our nurses have continued to serve with compassion, excellence, and strength. Today, however, we must move beyond praise alone because empowerment requires action. If we truly believe that empowered nurses save lives, then we must commit ourselves to creating an environment where nurses can thrive professionally and personally. This means investing in education and continuous training, improving working conditions, supporting mental wellness, embracing innovation, and ensuring that nurses have a meaningful voice in healthcare leadership and policy development. The ministry remains committed to strengthening our nursing workforce through professional development opportunities, improved standards of practice, and strategic partnerships that expand access to specialized training and advancement. We also recognize the importance of strengthening health workforce planning by using data and evidence to anticipate future needs, guide professional training, and improve the availability and distribution of nursing personnel throughout our healthcare system. As healthcare continues to evolve, so too must our investment in the people who form the backbone of patient care. Empowered nurses lead to stronger healthcare systems, improved patient outcomes, and healthier, more resilient communities. To our young people considering a career in nursing, your country needs you. Nursing is more than a profession. It is a calling rooted in compassion, service, leadership, and humanity. The future of healthcare in the Caribbean depends on the next generation of skilled and passionate nurses who are prepared to meet evolving healthcare challenges with excellence and innovation. To our experienced nurses and nursing leaders, thank you for mentoring, guiding, and inspiring those who follow in your footsteps. Your wisdom, dedication, and example continue to shape the future of healthcare in our nation. As we celebrate today, let us reaffirm our collective responsibility to support and value nurses not only during ceremonies and conferences, but every day of the year. A healthier future for our people depends on a healthcare workforce that feels respected, protected, supported, and empowered. In closing, I leave you with this message. When we invest in nurses, we invest in safer hospitals, stronger communities, healthier families, and a brighter future for our nation. To every nurse and nurse aide serving throughout our Turks and Caicos Islands, thank you. Thank you for your service, your commitment, your sacrifice, and the compassionate care you provide every day. Your hands bring healing, your voices bring comfort, your knowledge saves lives, and your services strengthen our country. I would also like to extend a belated Happy Mother's Day to all mothers present. We recognize that your care and compassion extend beyond your homes into your workplaces and communities, and we acknowledge the sacrifices and balance required to fulfill both roles with such dedication. I would also like to extend congratulations to our nursing graduates. And I would also like to recognize Nurse Sutton, our Chief Nursing Officer, who has continued to spearhead this conference, and thank her for her continued advocacy for the advancement of the nursing profession within the Turks and Caicos. I would like to wish you all a very happy Nurses' Day, and may God continue to bless you and the invaluable work that you do. Thank you.
Thank you, Dr. Astrid, and thank you for all that you do each day to advance healthcare here in the Turks and Caicos Islands. RPS, the Permanent Secretary in the Ministry of Health and Human Services, requires several clones. She's already been in a few meetings this morning, but we're happy to have her join us. And so we say good morning to Permanent Secretary, Mrs. Desiree Lewis. Thank you for taking the time to join us. At this time, we turn our attention to leadership and vision as we invite the Minister of Health and Human Services, the Honourable Kyle Knowles, to bring his remarks and officially declare this conference open. Honourable Minister.
Good morning, everyone. You may be seated. Before I begin, I just want to thank Nurse Sutton for the invite. Yesterday, before leaving, I heard this voice in the office, just going at it, trying to make sure that everything was in line for this morning. So with that, I do apologize that I do have to leave a bit earlier because we have an emergency cabinet at 11 o'clock. So I'll have to make a quick departure. But nonetheless, I deemed it very important to be here in support of Nurses Week. I don't know if many of you would have known, but my grandmother was a nurse. So I know the good nature of a nurse. For many of my cousins and my siblings, growing up, taking our vitamins, making sure we got all of our shots was a non-negotiable, even if it had to be administered by our grandmother. So we understand the importance of the role that you play in the medical field, and that you really are the backbone of the medical system and the healthcare system, not just here in our country, but around the world. Good morning again, distinguished nurses, dedicated nurses aides, healthcare professionals, conference organizers, partners in both public and private health sectors, ladies and gentlemen. It is truly a privilege for me as Minister of Health and Human Services to bring greetings this morning at this 5th annual Nurses and Nurses Aides Conference, held under the observance of International Nurses Day 2026. First and foremost, I extend heartfelt appreciation to each of you who gathered here and via streaming, those who serve on the front lines of healthcare across the Turks and Caicos Islands. Your presence here today reflects a commitment not only to the care, but your continuous learning, growth, and excellence. This year's theme, Our Nurses, Our Future, Empowered Nurses Save Lives, is both powerful and deeply relevant. It reminds us that the future of healthcare is in your hands, and our country depends on it. It depends on how well we support it, how well we equip it, and uplift our nurses and nurses aides today. Across our islands, in both the government healthcare system and the private sector, you play an indispensable role. You are there in our hospitals, clinics, community health programs, providing essential care, comfort, and reassurance. You are often the first point of contact and the steady hand that guides patients through their most vulnerable moments. You are also leaders, educators, advocates for healthier communities. As we gather this week, we are reminded again of Florence Nightingale's legacy, whose dedication transformed nursing into a respected and vital profession. Her belief in nursing requires both knowledge and compassion, and it continues to guide the work you do every single day. Nurses, as a government, we recognize the empowering role that you play, and it is not optional, it is essential. We remain committed to strengthening healthcare services across these islands, investing in training, education, and professional development, improving working environments and staff well-being, supporting recruitment, retention, and career advancement. We are also focused on preparing a healthcare system for the future, one that is increasingly shaped by technology and innovation. From electronic medical records to telemedicine and the advanced clinical tools, technology is transforming healthcare delivery. It is enabling you to reach patients across distances, improve efficiency, and enhance outcomes. Importantly, while technology will continue to evolve, it will never replace the compassion and the human connection that you bring to work and the strength you do it with. To all nurses and nurses aides today and across these islands, please note that your work does not go unnoticed. And I say again, please note that your work does not go unnoticed. Many of you have missed family moments, worked long shifts, responded during emergencies, comforted grieving families, and carried emotional weights for others. Today, we pause to say that your sacrifice matters, your well-being matters, and your contribution to this nation is deeply valued. You are the backbone of the healthcare system. You are the bridge between care and compassion. You are the strength behind healthier communities. Allow me to leave you with this reflection. The strength of any healthcare system is not measured only by the buildings, equipment, or technology. It is measured by the people who serve within it. In these Turks and Caicos Islands, our nurses and nurses' aides are central to that strength. whether serving in Grand Turk, Providenciales, North Caicos, Middle Caicos, South Caicos, Salt Key, or the other smaller communities. You help ensure that care reaches our people wherever they are. Jesus said in Matthew 25:40, "Inasmuch as ye has done it unto one of the least of those, my brethren, ye have done it unto me." As minister, I also want you to know that empowerment must be more than a theme. It must be reflected in how we listen to you and how we support you, and how we work with you and strengthen the system. Your voices are essential in shaping policy, improving services, and identifying practical solutions. We cannot build a future in healthcare without the insight and the experience of those who deliver it every day. As you participate in this conference, I encourage you to engage fully, share knowledge, build connections, and continue to strive for excellence. So thank you for your dedication, your service, and your unwavering commitment to the people of these Turks and Caicos Islands. When a nurse is supported, a patient is safer. When a nurse's aid is valued, a patient is treated with greater dignity. When the nursing workforce is empowered, the entire nation benefits. May God bless you, and may God bless these islands, and may God bless these beautiful Turks and Caicos. I now declare this conference open. I forgot that one part.
Thank you very much. So the minister has now declared the conference open. Nurse Gomez, we didn't detect the stress at all or the shyness. So thank you so much for that. Thank you for the timely and important reminder to nurses that caring for yourselves is not a luxury, it's essential. So remember to do it. In challenging environments and uncertain times, ethics become even more important. Our next presenter explores the delicate balance between workforce well-being and patient safety. Here's Dr. Josiah Blessing, nursing tutor, Turks and Caicos Islands Community College, to tell us more about the ethics of caring, balancing workforce well-being, and patient safety in resource-limited and disaster context. Dr. Blessing.
Good afternoon, everyone. Good morning. All right. It's an honor to stand here today before our beautiful nurses and nurse aides. Nurse Sutton, thank you for this opportunity, and I would like to stand on already established protocol. The ethics of caring, balancing workforce well-being and patient safety in a resource-limited and disaster context. Before I proceed, I would like to reiterate Happy Nurses Day. Our nurses, our future, empowered nurses save lives. I just wanted to point out that we had an invitation to bring some of our students here, but they couldn't make it. As I speak to you, they're actually entering one of their exams, so I decided to take a snippet for you. Thank you for all you have done. Cox, Melissa, you have really motivated all our students. They always make reference to you whenever I'm talking to them. Nurses are often asked to deliver safe care under pressure, and the presenter that just left outlined a lot of pressure factors that would cause pressure at workplace, right? But we all know that most of the errors in workplace are associated with pressure, stress, And in fact, more than 80% of medication errors are attributable to work stress. Resource shortage can create ethical tensions and moral distress. Disaster conditions intensify triage, prioritization, and safety concerns. And of course, burnout would affect your judgment, communication, and the quality of care overall. Ethics becomes most visible when conditions are most difficult. We know it is at that moment where you are struggling to give the patient your best that the patient will also be making the most demand of you. Emergency nurses in the house? Anyone working in A&E? ERO, yes. All right. So, with ethics, we know that this difficulty is tied to the pressure, but the pressure is asking you to deliver more. A paradox that we often deal with as nurses every day. Correct? Ethics to work, nursing, healthcare delivery hasn't changed. But you know our work environment is always dynamic, constantly changing, evolving. New tools, new protocols, new procedure every time. You have to learn them. You have to master them. Nursing ethics guide what we ought to be doing. And of course, it guides our professional conduct. It combines moral principles, professional standards, and compassionate judgment. Addresses duties to patient, family, colleagues, organization, and even yourself. Ethics is not only about rules, It's also about responsible action in the context where it is applied. Ethics inform every decision nurses make in practice. So, again, just to remind us, I know we are all aware of this. The core ethical principles, beneficence, acts for the good of the patient, nonmaleficence, avoiding causing harm. We speak about autonomy, we respect the choice of the patient, justice, distribute care and resources fairly, fidelity, remaining trustworthy and responsible, and veracity, to communicate honestly and clearly. Now, justice is a big issue when disaster hits. Justice becomes something you have to really hold your ground to maintain when the resources are limited. There are more ethical principles, but these are the core areas that if you hold tightly, you wouldn't fall out of that professional practice. Which one of these is the most critical in a resource-limited environment? According to our presentation, I'm a lecturer, so I might be acting like one. All right, so the ethics of caring, a moral commitment, not just an emotional response, requires compassion, competence, presence, and judgment, recognizes vulnerability, dignity, as well as the dependence of those you are caring for. It includes all care for patients, family, colleagues, and self. Ethical caring asks, what is the right and humane response now? Staff well-being and patient safety are interconnected. They are all intertwined. Our colleague has established that. Most of the speakers, keynote speakers, have established that before now. Patient safety, we must know. This expression good intentions alone do not ensure safe care. Safety depends on alert, supported, and competent staff. It depends on the quality of the resources available for care delivery. It depends on the functioning system, the leadership, the policies that are guiding the care process. And of course, we know that an exhausted staff are more likely to take or make errors, right? So, the workload distribution. But in terms of workforce well-being, it shouldn't be an opposition to the patient's safety. It should not. You shouldn't say, oh, I need my staff or my nurses to be well taken care of at the detriment of the patient. And the opposite should be same. The patient's well-being is not on a counterbalance with staff well-being. Ethical system aim to protect both. Depend on reasonable demands and supply. Demand and supply for human resources, for your instruments, equipment, and facilities, and so on. It depends on the support system and depends on the work tools being used. I always remember Henry Fayot. He says, give your staff a well-tuned tools and you will see how well they will perform. In TCI, most especially professionals may not be sufficient to cater for the need of the patients. Like we're talking about specializations. The hospital level is operating at secondary level. For instance, we have had to send our students to Jamaica for some tertiary experience, correct? And then some islands do not have this equal distributions of the hospital. For instance, we have Interhealth in Grand Turk and Provo. And then also, I know of other islands who do not really have that type of, so we would need to make room for transportation, referral, and all that. Service shortage, like specialists. Most diagnostic services, sometimes you have to send your samples abroad, right? Financial and policy constraint, who can access care, where, and at what time. And then coordination gap may also be present. We see all these things. Impact of limited resources in care settings. Staff shortage, increased workload, and reduced time for safe care. Limited equipment and supply forces you to make difficult choices. Delay in referral, diagnostics, and transport worsen risk. Nurses may work beyond ideal role boundaries, and under pressure. And ethical strain rises when expectation exceeds capability. And then the Caribbean, the tropical islands and tropical countries, with the events of the climate change and everything going on, intensified or heightened chances of disaster. We just had Melissa in Jamaica last year, right? Yeah, so we know once disaster hits, things like hurricane, outbreak, mass casualties, and system would disrupt our routine activities. And it's not strange. We are not in another continent where we are not used to hurricane and other things, right? Except for persons who are new in the TCI. So every year we prepare for hurricane. So, all right. Triage may largely replace first come, first served practices. That is where you start making those choices of who that patient is not breathing, that patient's hand is off, right? This kind of situation. Standard of care must remain the best possible under severe constraint. That is where you as a nurse now have to make tough decisions. How do I give the best possible care in the worst possible situation? And then communication, transport, power, and other things may be affected. Practice must remain ethical, fair, organized, and transparent. I do some volunteering with the Red Cross, and That's one of the key areas they would always emphasize in your trainings and refresher programs. You have the resources. People need the resources. That transparency is a key place, a key role as somebody who is attending to the vulnerable. Now, as a nurse, you would have seen or faced things like this: accepting an unsafe assignment versus refusing and risking abandonment or concerns. You are thinking within yourself, can I do this safely? Should I just say I cannot? Deciding who receives the scarce equipment, medication, or transfer first. Managing family expectations when services are delayed. A&E nurses, intensive care nurses. Continuing to work while exhausted and emotionally depleted. Your cup is like empty, but you're still pouring from it. Balancing personal risk, family obligations, and professional duties. Thank you for the detailed tips on how we can do that. My supervisor was saying that you should have also asked about husband and wife. You just said wife, your husband. Yeah. I felt carried. Yeah, should have also said that. Workforce well-being is an ethical issue. Burnout, like you have mentioned, reduces empathy without even you noticing it. It reduces your attention, and it can also reduce your level of engagement. You brush off things more than usual. Moral distress occurs when nurses know the right action but cannot carry it out for some reasons, whether leadership constraint, policy constraints, or any other thing that is holding you back. You cannot do it. It could even be because of resource shortage, but you cannot just do it. So you are just there. Compassion fatigue. Oftentimes we see people suffering. You carry that burden, whether you like it or not, you carried part of it. So over time, if you don't do anything about it, it can affect you as an individual. Psychological safety. This part often speaks to persons who are in leadership position, managers, even if you are managing just one person. Always, always give people that chance to express themselves safely. When that safety is compromised, people working with you will continue to work on eggshells, and it can affect the efficiency of the team. Ethical obligations. Protecting staff well-being is not a luxury. It's a necessity for every leader and every person in the nursing workforce. And we know that patient safety is an outcome. It's not just an action. It's interconnected. It's drawn from activities, from leadership, from other areas. So, if your nurses are always fatigued, errors, omissions, delayed responses, communication is bad, of course you see poor communication, then I did something, I didn't have time to document it, and the next person comes, she's not even aware it was done, and then everything is in chaos, right? And then we have the staffing issue, where you have limited staff members running the system, and then you have to probably shuffle nurses between one unit and the other, and so on. We know how it is in nursing. Yeah, it's not just speculative TCI, trust me. I worked in a military environment where I had to do 7 nights straight. And when I finish, I'm like, you know, that black eye. Yeah, it's like I'm wearing sun shades. Yeah, it's not just hair. Events, intent versus outcome. Again, in a poor resource environment or resource poor environment, excellence becomes an intention and not a practice. And we have established before that intentions or good intentions alone do not ensure safe practice. When you say, oh, that is what I would have, that is what we should have, that is not what the patient needs. The patient needs action, right? A balanced workforce is a safe workforce. Now, this is just I pulled some researches that supports workforce connection with patient safety. If you look up, you'll find this study looked at 55 different studies, and they all consistently link patient experience, for instance, patient safety and clinical effectiveness. Most of all, communication, respect, responsiveness, and patient involvement are closely related to safer care and better outcome. I'm going somewhere. A stronger hospital safety culture is associated with a lower risk of adverse events and better patient outcome. Now, this open communication, this is where we are. Teamwork, leadership commitment, and non-punitive reporting are recurring features of safe healthcare system. This is becoming an issue in some countries. I have colleagues in the UK who are so scared of doing certain, like taking initiatives, because there's a manager somewhere who is waiting to say, I will detix you. It's not about the action now, it's about the person. You are so focused on targeting the nurses under your care or under your leadership that you are not thinking about their effectiveness anymore. You are looking for errors, where they fall short, where they made the errors, so you can write them up. When that becomes the norm, the focus of care becomes, quality becomes degraded. For both studies, we gathered that the patient safety is strengthened not only by protocols, but also by trust, communication, and organizational culture. And then, for the workforce, your own part, for your own well-being, employees' health and well-being are shaped by job resources, stressors, teamwork, leadership, and work design. Sometimes we are so busy that we forget to redesign things that are in existence. Because it's handed over to us, we take it as it and run with it. We don't sit down to say, oh, okay, as at the time this was designed, the patient workload was probably different. Let's rethink, let's redesign based on evidence. We just keep doing it like a machine, keep rolling, and keep rolling, and keep grinding. We need to update our systems. Well-being influences behavior, engagement, and functioning at work, making it important for reliable services and delivery. And then the last one, a scoping review of 98 studies found that most employer-sponsored well-being programs usually focus on physical health, mental health, or the work environment. Important equity gaps exist. Now, few studies examine outcome for historically underrepresented or low-waged worker groups. Oftentimes, we neglect the soldiers of the healthcare system, those carrying the weight. We're looking up, we're looking at the surgeons, the specialists, and all that, but we forget that people are actually at the bedside, making sure that these patients are sleeping well, their pillow is well positioned, and this and that. That's why nurses' aides come into play. Are we paying attention to them? Are we helping to build the grassroots, which actually is the cornerstone of a successful healthcare system? Workforce well-being improves when support is structural, inclusive, and built into the work environment rather than left to individual coping. Yes, we'll breathe, we'll stretch, we'll go out for fresh air, but we need a supportive system in place to do that. Because if I am attending to 6 critically ill patients, I don't have the time to step outside of their wards to take any fresh air. I'm going to stay there for the 12 hours on my feet, gathering probably proteins in my urine, and so on. My health is going to get jeopardized, right? We need a system that is able to set the clock and say, nurses, you don't only have to wait for 6 hours to take a break. How about we design a system where you can take a walk every 50 minutes to take a fresh air, like he recommended. Sorry. All right. You understand the point, right? Design. System design. Okay? Now, for all of us, we know we have to make decisions. Sometimes we make decisions, and it's a split seconds to make such decisions. When it comes to saving life, you have to be very rapid. So this is just a step 1, 2, 3, 4, 5, 6 you could use, or you could just jump to the other one, which is idea. Use, identify the problem, determine the relevant ethical principles, explore the options, and then you take action where necessary. These are in your textbooks, so I don't want to teach. Now, applying a framework in practice, you could also just understand medical word applied. I can share the slide later. High equity, limited staff, delayed tasks, rising, people affected, patient, family members, nurses, aides, and every other person. And then you look at the principles. Okay, let's look at the benefits. Who is going to go to benefit? Who is going to harm if we don't do it well? And then what are the resources to be shared? Talking about equity and justice. And then accountability. How do we report this? Who is responsible for who and when? Okay, so that will be prioritization of care, escalate concerns, reassign tasks, and so on and so forth. So let me just move over that. But one important thing you should know as nurses, colleagues, leaders, everybody, evidence-based best practices and policies should always be your Bible, if you're a Christian, should always be your Quran, if you are Muslims, and whatever you believe, it should always be your light to guide you in practice. All right, so I'm going to jump over that. We all know about hurricane and so on. Practical, as I round up, I'm going to look at the practical and leadership action reminders. For the nurses and nurses' aid, learn to speak up early if you're having distress. If the environment becomes unsafe, speak up. Prioritize using acuity, urgency, and risk of harm. Document delayed, omitted, or adapted care. If there's any modification to the norm, document. All right? And then support one another through teamwork and peer checking. Thank you very much for that. And then monitor personal fatigue yourself. I lost a very dear friend in Jamaica. He was in his housemanship. A lot of work. He actually collapsed in the hospital. He was a doctor. He had a heart attack while caring for other persons. And then he died. 5 years, 6 years wasted. For healthcare leaders, ensure that there's a clear escalation pathway. If I'm in the unit and I have challenge, who do I go to? Who do I speak to? Which line do I call? Who do I escalate this to? Promote psychological safety and communication. Make people comfortable in speaking to you in the unit. Support debriefing and rest and recovery. I'm very, very much conversant with the InterHealth system. They promote these a lot. I'm not sure if acting CEO, Nosbin, yes, I've been in the hospital multiple times with my students, and oftentimes I see this going on. Thank you for all the work you are doing. Align staffing and policy decisions with fairness and transparency, and ensure that the workforce and resource can match the demands, both on a regular day, and if there is a critical moment, like a hurricane, or mass casualty. And for the educators, that's for us. Teach ethics and safety together. Use realistic case scenarios and simulation. Nurse Ferguson. Promote speaking up and reflective practice. Strengthen teamwork and delegation and escalation skills from the education stage. And mentor for resilience and practice. Oftentimes my students will come, do we really need to know all these? Yeah, you need to know all of them. And for the government, we know it's about policy, financing, infrastructure, and creating security for the healthcare workers. Now, as I conclude, I'll bring you to the Rotary four-way test. It says, of all the things we think, say, or do, is it the truth? Now, in the hospital, are we willing to acknowledge with transparency and integrity both the strengths and the constraints of our system so that our decisions are grounded on reality rather than optimism only? The second point, is it fair to all concerned? Do our choices about resource allocation, staffing, and access to services strive for fairness to patients, family, frontline staff, and the wider community, including those on our more remote islands? Next, will it build goodwill and better friendship? Are we communicating and collaborating in ways that strengthen trust between policymakers and practitioners, between institutions and the public, and with our multidisciplinary systems? And lastly, will it be beneficial to all concerned? When we weigh options in resource-limited and disaster contexts, are we seeking solutions that safeguard patient safety, protect the well-being of the workforce, and support the long-term resilience of the healthcare system, or we are just doing as we deem fit for ourselves? If together, nurses, nurse aides, leaders, policymakers, we can increasingly say yes to these questions, then even when resources are constrained, we can move towards future where ethical caring, sound policy, and public confidence reinforce one another for the benefit of all whom we serve. Ladies and gentlemen, thank you for having me. Our nurses, our future. Empowered nurses save lives.
That was awesome, wasn't it? Okay. So Dr. Blessing reminded us to always let the evidence-based best practices and policies guide you in all that you do. And of course, those of us who are Rotarians and Rotaractors and just the general nursing fraternity to remember the Rotary four-way test. What was the first one? Somebody said it. Is it the truth? Yes? Next? You sound like you're a Rotarian. Is it fair to all concerned? Number 3? Will it build goodwill and better friendships? And number 4? Exactly. Will it be beneficial to all concerned? So thank you so very much for that.